So everything we're doing, including vaccines, is just kind of making layers between us and the virus. So the social distancing is a layer, the hand hygiene is a layer, the face mask is a layer, and the vaccine is also a layer. So what we need to be doing is putting as much of those layers between our children and the virus. And for anybody over the age of 12 now, the thickest layer is vaccination. So that's where I would begin to get us our numbers of 12 to 17 towards that herd immunity number that for the Delta variant is probably going to be 85 or so percent. Thank you, Mary. Yeah. So that's the way we have to think about it. It's just how many layers can we put between our children and the virus, and which are the most effective? And the most effective, from what we know right now, is vaccination, and of course, then adding those other layers to even make the chance of infection less and less still.
Mm-hmm.
And I'll just chime in. I'll just chime in. I think this question is different whether you're thinking about it from the school perspective or a parent's perspective. So, schools are really we're trying to get schools to think through all these layers so that we have all different kind of things working to protect our students and keep them safe. But there's actually a lot of layers that a parent can do as well. And having conversations with your student about masking throughout the day. Frequent hand washing, I think, is always kind of under, it's such a simple thing and it gets forgotten of what a big role it can play with preventing all different kinds of disease. So I think, discussing that with a student is really helpful, maybe sending them with hand sanitizer. And then also continuing to monitor your student closely for, any signs and symptoms of illness that are going to be out of the ordinary. And that's really what you want to be looking for. So, parents know their child's health really well. You may know that, it's August or September, and that's when my child gets whatever allergy. And they're going to show that as sneezing and itchy eyes, which are not symptoms of COVID-19. But if something's starting to pop up for your child that's a symptom that's new or really out of the ordinary, one of the most helpful things that they can do is stay home at that point in time. At least for right now, the days where you just kind of, have a cold and have some Dayquil and go on your way, we're shifting away from those as much as we can, just because that's when people tend to spread COVID, even more is in those first couple days and even before they're showing symptoms. So anything that could be COVID, please stay home and keep your child at home.
Thank you, Allison. That you touched on something that we do get asked a lot too. So if someone starts showing symptoms, they've been exposed, maybe didn't know, they're considered infectious. How far back from the onset of symptoms?
Sure. So you're considered infectious in the 2 days preceding the onset of your symptoms. So, if I started showing symptoms today, I would also have been considered, today's Thursday, I would have also have been considered infectious yesterday on Wednesday and then on Tuesday as well. So as we at the health department went through the case investigation contact tracing process, we'd be looking at who you were in close contact with on that, Wednesday or Tuesday and Wednesday, which is where things get really sticky, that you didn't even know that you were sick at that point in time. But what we're seeing is that that's when people are really shedding a lot of the virus, and they're actually very infectious.
And so contact tracing is really, really important to helping stop the spread, isn't it?
It is. That is actually just one of those layers that's how we, we want to test people to identify who may have the virus. And, you can also, self-identify that you're showing these symptoms. But anything that's going to identify you as a case, and then we want to keep you away from others, and then also stop the spread by getting in touch with your contacts and having them quarantine at home for a period of time.